Hi, my name is Katie Brigham. I'm an adolescent medicine specialist in the Department of Pediatrics, and I'm here with Jonathan Slutzman, who is a member of the Department of Emergency Medicine at MGH, and we're here to talk about sustainability at MGH. First of all, Jonathan, why should we care about sustainability in healthcare?
That's great. And thank you, Katie, for having me and for engaging in this really important topic. Healthcare sustainability, particularly environmental sustainability, is supremely important. Healthcare is responsible for close to 10% of the greenhouse gas emitted in the United States annually, which translates into hundreds of thousands of disability adjusted life years lost. It's on the same order of magnitude as the impacts of medical errors on our communities and our patients. People are literally dying and suffering horrible morbidity because of pollution. Some of that, a large fraction of that, coming from healthcare operations itself. And we are clearly a field, an industry that has a mandate to do no harm and to take the best care that we can of our patients and our communities. So it's incumbent on us really to set a good example, to protect our communities, and to provide the necessary care that we do, the life-saving care that we do, in as environmentally friendly and responsible a way that we can.
Yeah, wow, that clearly there's a huge impact on human health from the environment. How is MGH addressing sustainability issues?
That's also really important to discuss. First, we should recognize that MGH has been a leader in environmental sustainability for decades. There's been work happening since before you and I were here, and will certainly continue. We've made some great strides. It started quite a long time ago with the REAL committee, and has progressed to a group greening the OR in perioperative services, and then goes all the way up into Mass General Brigham leadership, where a lot of our energy management is really happening. So the big piece that I think everybody should take away is, first of all, 100% of the electricity used at Mass General is from renewable sources. And that's something that we should all be proud to work someplace that's doing that. And it's not something that we necessarily say enough, so most people don't even know it. We can also say that in the city of Boston, all commercial buildings have to report their greenhouse gas emissions intensity, which is the amount of greenhouse gas emissions that are emitted per square foot of floor area in their buildings. And hospitals are no exception. If you look at all of the hospitals in the city of Boston, Mass General is consistently year after year, if not the lowest number, pretty darn close to the lowest number, better than the vast majority of hospitals in the city with respect to greenhouse gas emissions from energy use. So we've done great work there. We also do pretty well with things like waste, particularly our red bag or regulated medical waste, which can certainly be improved, but we manage it on site, which actually reduces the emissions associated with it quite a bit. And that's worth noting. Our cafeteria waste is another area where we're doing some good work, particularly with composting of our organic waste, where it gets handled by a vendor that puts it through an inorganic digester and takes the methane that comes from the decomposition of those organic matter and turns it into a fuel for cogeneration facilities. And then what's left is used as fertilizer for farmlands in New England. So those are some really great things that we've done. We're continuing to do more. Over the last nearly 2 years, an executive level sustainability committee has been working under the leadership of Sally Mason-Bamer, our CFO, bringing together heads and other folks from a variety of departments, from non-clinical and clinical care, to really identify what are ways that we can do better, whether it's through transportation or facilities or purchasing, or the care that we provide. So we're continuing to improve our footprint, but there's always at every institution room to do more. And I think that we're really excited to really reclaim our leadership position in the nation and even the world, to show what an environmentally responsible, climate smart healthcare institution really looks like.
That's great that MGH is already doing such concrete steps to help the environment. And I understand that MGH is also launching a new Center for the Environment and Health. Can you tell me a little bit about this?
It's super exciting, Katie. Thanks to the leadership and support of Dr. Slavin and Dr. Ferris, we are launching this month the MGH Center for the Environment and Health, which is a place for all of these efforts to come together to bring environmental issues and the climate crisis to all of the hospital's mission areas. So we, as I mentioned, are really bringing sustainability into our clinical operations and how can we provide the care that we do in the best way that we can. But we're also expanding, and this is where we're unique among healthcare institutions with a sustainability office. We're bringing it into our research portfolio and saying, how can we study the links between environmental degradation, climate change, and human health? How can we study ways for healthcare institutions to be more sustainable? How can we quantify those? We're bringing it into education. We need to make sure that our staff, our faculty, our fellows, our residents, our students, everybody around us, both inside the institution and outside the institution, can understand these links between the environment and our community's health, and can understand how we can do better individually and collectively. And then lastly, we're bringing these ideas into the public sphere. How can we protect our communities and advocate for them so that science is really playing the role that it needs to in our public discourse when it comes to the environment and the climate crisis. So we have a great bench of people here at MGH, researchers, clinicians, who can really bring to bear their knowledge and expertise to these questions and provide their expertise to people outside who really need it to make important decisions. So super exciting that the center is launching this month. There are plenty of opportunities for people to get involved. We love to hear from people. And I'll put the pitch in now. If anybody wants to reach us, you can email us at CEH, that's Center Environment Health, at mgh.harvard.edu, and any member of the MGH community is welcome to become a member of our center. If you're a researcher and are interested, you're studying heart failure and you're curious, how does the environment impact heart failure? How can I bring that into my research portfolio? We are here to be a resource to you to put that lens onto it. If you have questions and want to learn more, ask us and get connected to the Grand Round series that we're launching this summer, starting with a half-day symposium at the end of May that anybody is welcome to attend. If you're interested in what can I do on my own clinical unit, or you have an idea of some sustainability item that we should be investigating and perhaps implementing, then please get in touch with us. We'd love to hear about it. And then we can talk about the ways that we can all get involved, that we can all make a difference, and we can make the MGH even better than it is.
Great. Well, thank you so much for telling me about all the wonderful things MGH is already doing with regard to sustainability and the steps we're taking towards the future to make sure that this is in the forefront of everyone's minds.
Yeah, it's super important. Thank you so much, Katie. And we are amazingly excited, our team of clinicians, of non-clinicians, of staff people, to really show the community how much we have been doing and how much more we're going to be doing.